Hello, it's Dr. Wright here with our next video in our series on injectable fillers. Today we're going to be injecting Voluma, which is a hyaluronic acid filler, FDA approved for augmentation of the cheek. Voluma has many unique properties. Again, it is the only filler that is specifically FDA approved for augmentation of the cheek and the mid-face area. Additionally, it is injected deeply. This is it's a fairly firm filler, secondary to its cross-link, the way it's developed. It tends to hold its shape very well, and for that reason you could use it to build up bony areas like the cheekbone. But for that same reason, it's not the sort of filler that you would want to use in the lips, for example, or in the eyelids. It's simply too firm for those areas, and you'd prefer a softer, a more moldable hyaluronic acid filler like Juvederm or possibly Restylane. Another of the unique properties of Voluma is that it may last up to 2 years. So it's FDA approved at 2 years, and it may persist even longer than that. So it does persist quite a bit longer than other hyaluronic acid fillers. Now, as always, it's important to do your homework and find an experienced injector, someone who has a lot of experience with Voluma or with any of the other fillers that you might choose. So again, the cheek is a three-dimensional structure, and proper analysis is crucial whenever you're considering doing a filler injection. The cheek is divided into certain subunits, including the anteromedial cheek. Volume loss in the anteromedial cheek, in this area right here, can contribute to what we term the tear trough deformity. Jamie actually has very good volume in this section of the cheek, so we're going to move laterally to the malar cheek, or what people call the cheekbones. The cheekbones contribute to that OG curve, that is the curve that forms in three-quarter view, if you don't mind turning, yes. That curve that forms when the malar cheek, the convexity of the malar cheek meets the concavity of the submalar region. It gives that nice full sort of mound of the cheek there. You can turn back for me there. Alright, so that's the malar region. Then we have the zygomatic region, and this is important because the cheek again is a three-dimensional structure. It sort of blends into the remainder, or the posterior cheek just in front of the ear. It tails off here, and it's important to note that because I've seen some injectors who neglect this area, and it's sort of a telltale sign of an improper injection when the augmentation just sort of ends there, and the patient is left with a relative volume loss posterior to that. Moving down, you have the submalar cheek. That's the submalar area right here. Again, the OG curve, where that concavity of the submalar meets the convexity of the malar cheek. That's the OG curve. That's the curve of youthfulness that we're trying to recreate with the Voluma. So here we have Jamie, who has nice, beautiful cheeks, but could benefit from some more volume in this area. A bit of a shadow coming through the cheek here. We're going to add a couple of drops here. We're going to use a syringe of Voluma on this side, a syringe of Voluma on this side, and a younger patient who has nice skin elasticity like Jamie does, less is more. So you're essentially adding the tent pole back into the tent. In an older patient, less skin elasticity, you may find that you need to use 4 or 5 syringes. In a younger patient, 1 to 2 should be sufficient. Alright, starting off in this area. Now, Jamie has some topical numbing medication on board. You could also use dental blocks, which will numb the entire cheek. I find that patients using Voluma for cheek augmentation don't need quite that depth of anesthesia, and the topical medication seems to do very well. So we prime the Voluma. If I could have that, thank you. I'm going to start in this area. Again, this injection goes right down to the bones. You palpate the cheek, right there. Right down to the bone. You can already see how it's filling out that area. And again, as the cheek tails off toward the posterior cheek, you don't want to neglect that area. Poke. Can you see there's very little bleeding? A little drop just posterior to that. Alright, a little Vaseline. Thank you. Again, hyaluronic acids like Voluma can be massaged, and they behave very well in the face. Alright, turn toward me. Okay, back. Now we're going to concentrate in this submalar area here, which contributes to sort of the apple of the cheek. It's also important to note that you don't have to complete one side before you move to the next. You could allow the lidocaine that's loaded into the Voluma to work, move to the right hand side, and then come back to this side after that lidocaine has allowed for adequate anesthesia. Now, if you should have some pinpoint bleeding from the injection site, it's not a reason to panic. Just hold some pressure for about 30 seconds and that will stop that oozing from happening. A true bruise from Voluma injection is fairly rare, owing to the depth of the injection and the paucity of large caliber vessels in that area. Alright, turn toward me. Taking your time, going slow. Realizing that most patients have at least some recognizable asymmetry that you need to account for when you place the Voluma. Okay, turn away. I'm going to add a little drop right here. Now, what you can see is that augmenting this malar area has created a nice shadow in the submalar area, and this is there. Again, moving posteriorly toward the zygoma. Don't want to neglect that. And like on the left hand side, now we're going to concentrate on the submalar region in an effort to even things up, accentuate that malar mound. Don't forget that this patient smiles, so smile for me. Things need to look natural, both when a patient is relaxed and you can relax, and smiling. And we are all done. So how did that feel, Jamie?
Felt great. Didn't hurt at all.
All right. Smile for me. All right. You can relax. Now you can open up your eyes. All right. And just for the camera, if you don't mind, trying to smile.
Looks perfect. I couldn't be happier. I'm very pleased with the result. Dr. Wright did a fabulous job and I barely felt any discomfort.